Good afternoon, ladies and gentlemen, and welcome to today's webinar. I would like to remind you that this conference is being recorded. At this time, all participants are in a listen-only mode. For those connected by telephone requiring operator assistance during the call, please press *0. Web participants requiring support should use the chat feature on your screen. I would now like to turn the meeting over to your moderator, Dr. Jamie Brown, Senior Corporate Evaluation Lead at the Canadian Foundation for Healthcare Improvement. Please go ahead.
Hello, and welcome to today's on-call webinar entitled Insights from Canadians, the Current State and Future Priorities for Healthcare in Canada. As your moderator said, I'm Dr. Jamie Brown, Senior Corporate Evaluation Lead here at CFHI, and I'm pleased to be your host today. The Canadian Foundation for Healthcare Improvement is a national, federally funded, not-for-profit organization dedicated to accelerating healthcare improvement. We're also a proud member of the Healthcare in Canada initiative. We are pleased to have more than 350 registrants for the live and on-demand versions of this session today. As I introduce our guest speakers, I'd ask that you please take a moment to introduce yourselves in the chat box. As well, please let us know how many people are attending from your location using the poll on your screen. Please enter the number including yourself. So our presenters today will be sharing highlights from the 2016 Healthcare in Canada survey. Joining us today are Dr. Terry Montague, currently a principal at CareNet Corporation Limited, a healthcare management consulting company. Dr. Montague is a thought leader in the field of health social networks with a primary focus on optimizing the care and outcomes of our aging populations with chronic illness. In 2016, Terry was appointed to the Order of Canada for his contributions to the management of cardiovascular disease and to the advancement of patient health management. Dr. Montague was previously a professor of medicine and director of cardiology at the University of Alberta, vice president of patient health at Merck Canada, and Director General of the Disease Management Research Group at the University of Montreal. A veteran of military service in Canada and overseas, his current affiliations include editorial advisory boards of Healthcare Quarterly and Healthcare Papers, Royal Canadian Regiment Association, Royal Canadian Legion, and President's Club of St. Francis Xavier University. He has been a contributing member of the Healthcare in Canada survey since its inception in 1998. We also have joining us Craig Warden, Executive Vice President at Polaris Strategic Insights. Craig leads Polaris Strategic Insights research divisions and the development of their research models and products. He provides actionable, insightful counsel to their clients, applying expertise gained over almost 20 years of conducting quantitative and qualitative research for an extensive array of private, public, and not-for-profit sector clients. Throughout his career, Craig has been a recognized health affairs research specialist, leading research efforts for the National Primary Healthcare Awareness Strategy Task Force, Polaris Electronic Health Records in Canada study, and more than 50 hospitals, LHINs, and healthcare not-for-profits and charities. Craig holds a BA Honors and an MA in Political Science. And last but not least is Joanna Nemes-White, principal from Thrive Health Management Consulting, Inc. Joanna has worked collaboratively in the healthcare industry across Canada since 1990. For more than 19 years, she has developed and supported continuous quality improvement partnership projects aimed at enhancing patient care and outcomes with numerous and diverse healthcare stakeholders in both the public, nonprofit, and private sectors. Joanna has worked with Merck Canada in a variety of roles for over 19 years before founding Thrive Health in 2010. She is skilled in knowledge translation, has co-authored numerous peer-reviewed publications, and has been actively involved with the Healthcare in Canada survey since 2012. We also have our producers, Sheena Powell and Kelly Ripley, operating behind the scenes here in Ottawa, so thanks to them. And of course, I want to welcome all of you on the line. We're pleased to provide simultaneous interpretation for all on-call webinars. This may result in a few quick pauses in the dialogue today. We invite you to participate in our chat box today in either official language. We have dedicated time at the end for a more formal question and answer period with our speakers. At that time, I will read the questions you've posted to the chat box aloud for our speakers to respond to. Now, before we begin, I'd just like to highlight the objectives for today's webinar. The main objective, of course, is to present the opportunity for our audience to learn about the 2016 Healthcare in Canada survey results. Second, we hope that through your participation, you can begin to explore how the survey can benefit your organization's decision-making processes. Third, we hope to gain insights into the possible future innovations and improvements in healthcare. Now I'd like to hand it over to Terry, who will get us started with some of the history behind the Healthcare in Canada survey and its measurement, and its membership. Thanks.
Our most recent survey, which was launched in mid-2006 and which is going through the knowledge translation processes now, of which this webinar is a very important component. Over the course of the last 2 decades, dating back to 1998 when the first survey was done, we've completed 12 surveys of the adult Canadian public and a broad spectrum of healthcare professionals. The purpose of all 12 of these surveys has been very simple and continues to be so. It is the identification of concerns and opportunities to inform strategic health policy and clinical decision-making, all leading, we hope, to improved health care and outcomes for all Canadians. From the beginning, I would say, and continuing up till now, I will assure you, there have been 3 principal strengths underlying the Healthcare in Canada endeavor. They are partnership, measurement, and communication of knowledge gained. It's a very simple formula. Partnership and measurement seems to produce results to make things better. As per this slide, you will see the broad stakeholder partnership on the most recent survey. If your organization is interested in becoming a member or desires more information about the team and its endeavors over the years, you can contact us via the HCIC website shown on the slide. Now I would like to pass to Craig Warden, the Executive Vice President of our longtime partner, Polera Strategic Insights. Craig is standing in for one of his colleagues who unfortunately had a very unhappy event and couldn't attend today. So I appreciate you stepping in, Craig, very much. Craig did, however, oversee the launch and statistical analysis of our current survey and is very intimately attuned to all of our previous surveys, I believe, as well. So thanks for coming, Craig, and I hand it over now to you.
Thank you, Terry. My pleasure to be here. And Leslie Martin, our Vice President, who really did lead the charge on this study, sends her regards and is very disappointed that she could not attend herself. But I'm happy to take the reins in her absence. A brief word or two about what exactly we did in terms of the methodology here. We did an online survey. And it's really multiple surveys among a number of different audiences. It was conducted from May to June of 2016 amongst nationally representative samples of the Canadian public, and you can see there's a very robust sample of 1,500 Canadians there. Doctors, nurses, pharmacists, administrators, and allied health professionals. And in those professional categories, you can see we have about 100 surveyed in each category. Now we'll get straight into the trends and where were we the last time we did this survey and where are we now? You can see here some good overall questions to start the presentation where we ask Canadians whether or not they're receiving quality health care. And a word about the presentation format. You'll see that in the top right-hand corner there is a map of Canada, or you'll also see the sort of commonly used medical symbol. So we're using that to sort of clearly indicate that when we have the map, that indicates the results amongst Canadians. And where we have the symbol, the medical symbol, that indicates that these are the results amongst healthcare professionals. So here we're looking at Canadians. You can see that clear majority of Canadians, 58%, say that they're receiving quality health care. And that's been a steady result for us since 2003. So in 2002, we were down around 53% saying that, a very slim majority. And it popped up in 2003, and it's remained quite steady since then. So 58% saying that there's quality health care being received. Men are more likely than women to say this, 63% of men versus 53% of women. And those who have better health, who report themselves having better health, are more likely to say that they're receiving quality health care. So those who say that they're in excellent health, 66% of them say that they're receiving quality health care, whereas those who have fair to poor health, self-reported, only 37% of them say that they're receiving quality health care. Same question, and it's still about whether Canadians are receiving quality health care. The perceptions and opinions of healthcare professionals are higher. They're more positive, except when it comes to nurses and allied health professionals. But looking at doctors and pharmacists and administrators, you can see clearly 7 in 10 on up to 3/4 are saying that Canadians are receiving quality health care. The standout figure here for us, in a case where a lot of these results are very steady over the years, is nurses have dropped from 62% saying that Canadians are receiving quality health care down to 46% this time. That's quite a drop, and that negative result from nurses is a common theme that runs entirely through this entire data set. So nurses throughout, and you will see, nurses throughout this data set are more negative, and noticeably so, than the other healthcare professionals. And near the start of the survey, we like to ask this open-ended question. So by open-ends, I mean that we're letting them respond in their own words rather than providing a set of responses to choose from. And we ask them, what is the most important healthcare issue facing Canadians? Wait times, clearly, over and above all the rest, clearly stands out, a lightning rod, if you will, across the top with 36%, and that has been moving up since 2007 in particular. So 20% in 2007, 2013 it went up to 31, and still it's going up again in this iteration of the survey with 36% saying wait times. Doctors, the shortage of doctors has gone down over the years from 19% in 2007 to 16% in 2013, and now it's down to 13%. So that is interesting. And now when we look at this same question by the healthcare professionals, the general public do not mention availability and accessibility in a major way, although that is clearly linked to wait times, I would say. But this issue is mentioned by healthcare providers to a far greater extent and very much in the same degree as wait times. So you can see here accessibility and availability and wait times are top issues for all of the healthcare professionals across the board. We'll get into access. Now, what are the public sources of healthcare information? And I'm sure most doctors would agree, and they've heard this from their own patients, that the internet is a common source of information for Canadians when they're seeking out healthcare, even a little bit more than their own doctors or their own primary care provider. And what exactly are they using on the internet? When we dig deeper, we find that it's primarily Google searches on whatever the issue is that they're facing. WebMD comes below that, and Wikipedia below that. Now, looking at whether or not Canadians, in this case, feel that timely access to care has improved or worsened or remained about the same over the past 5 years. And here you can see down the right-hand column, that's our net momentum score. A net momentum score is simply taking those who say it's improved and subtracting those who say it's worsened. So if it's a negative score, that's bad. It shows you negative momentum, meaning things are going down. And if it's a positive result, then that's positive momentum. There's a perception that things are getting better. Healthcare in general, the top box, highlighted in it with pink, there's a perception there we have negative momentum, so minus 35. More people are saying it's getting worse than say it's getting better. Now, the one positive result here is that access to pharmacists providing primary care, that has gone up. There's more saying that that's getting better than getting worse, with a net momentum score of plus 21. All the rest of the different aspects we've tested here have a negative momentum score, especially at the bottom, specialists with minus 49. And you can see 56% of Canadians saying that access to specialists has worsened, and only 7% say it has improved. When we're looking at healthcare providers, and this is just in terms of timely access to the healthcare system in general, in the case of this slide, nurses are the most pessimistic. They're all providing a negative momentum score here, but nurses, as we've seen throughout this data set, are the most pessimistic, and in particular compared to the last iteration of the survey. So in 2013, they gave a negative momentum score of minus 27, and now it's minus 36. So again, nurses are seeing, to their eyes, a much worse healthcare system overall, and in each of the specifics we've tested. Not shown on this slide are the other elements that we tested, like we did with Canadians in the previous slide. When we go through those, they show similar trends across the board as Canadians. Where things are different is professionals feel access to nurse practitioners and pharmacists offering primary care. They feel that they have improved. And some healthcare professionals, although not doctors, but most of the rest, feel that access to new medicine has improved. Now, on this slide, you can see we've tested a number of different improvement proposals, and we've asked Canadians, on this slide, this is the general public, whether or not they support and to what degree, or oppose and to what degree, each of these proposals. Now, you can read down the left-hand side to see the different proposals before them. This is a story of strong support for the team approach. In fact, they're most in favor of increasing medical and nursing school enrollment and requiring health professionals to work in teams. And these results are similar to 2013. There's limited support for requiring patients to register with just one primary healthcare professional. And that support for that idea has been slipping since 2013. So, moving on to some of the sort of key elements that we tested here amongst healthcare professionals. Healthcare professionals continue to support an increase in medical and nursing school enrollment, with the strongest support from this coming from nurses, and very much in line with what we saw with the public. As with the 2013 edition of the survey, requiring healthcare professionals to work in teams with other types of healthcare advisors received the strongest support. Although support of this initiative among doctors remains moderate, as it has in the past, with 54% on board there, the results are still fairly similar to 2013. So when we ask Canadians, over the next 5 years, do you believe that Canadians' access to the following will significantly improve, worsen, or stay about the same, Canadians have little hope for an improvement in the timely access to health care. Similar to last year, it has not declined, but there is nothing to make Canadians hopeful at this stage in the game. They are more optimistic about the quality of the health care that they receive, only slightly more positive, though, than last year's results. And looking at the future of healthcare access amongst healthcare professionals, in terms of timely healthcare service, professionals are more pessimistic than the public, and more than they were in 2013 for most of the healthcare professionals here, other than doctors, who remain quite steady in their negativity. In quality, there we see that the results are better, much like with the public, than timeliness, but still negative, and the results are notably worse than 2013. So you can see, the expectations here amongst doctors, amongst nurses, the negative scores have more than doubled in terms of negative net momentum. I'm going to move on now into our medication adherence section. And this is where we start off and we ask, do you currently take any prescription medications on a regular basis? Regular meaning daily or weekly basis, and how many different types? And then we get into whether or not they're in adherence with what their doctor has told them in terms of how, what to take and how often. First, you can see that the number of drugs taken are somewhat down from 2013, moving from 45% to 40%. And that non-adherence is quite consistent with what we saw in 2013. So 52% are in non-adherence. We do find that the younger are more so. Only 35% of those under 45 are always compliant with the instructions they received about their medications, compared to 49% of those aged 45 to 64 and 55% of those 65 and older. Now, what are the reasons for this non-adherence? First of all, they are most likely to take their medications less often, so a lower frequency or a lower dosage in particular. And the main reasons are that they forget or they don't feel that they need them anymore. And they take them depending on how they feel. So there's a lot of self-diagnosing and self-doctoring, if you will, on this. Now, when it comes to managing chronic care, as you can see from this slide, they do understand. They understand about side effects. They understand the reasons why medications were prescribed. They understand a lot, or they claim to understand a lot about medications. That's not the cause of non-adherence. It's not a professed lack of understanding. It's something else. Maybe it's a feeling of that they know better, or it's just a feeling of, as we saw on the previous slide, that they don't feel that they need to take the medication anymore. Now let's look forward and search for some best directions. So when asked for support over a list of potential solutions to patient-centered care, we find high support across the board. And when we ask them to pick three, they're sort of top three from this list, and that's what you'll see down the side. Having care that's readily and timely accessed is at the very top. It was the highest, it was the top picked item as well in 2013. And it's gotten slightly stronger this year from 72% to now to 76%. Care that's provided in a caring and respectful context, that's the third bar in the list, that's moved down from 55 to 38%. But that's because we've introduced a new item this year, and that is the second item that receives 60%, and that is care that is based on need and not on the ability to pay. So a core tenet of our healthcare system, and we've seen it in many surveys here and other surveys, that is a core tenet for Canadians about our system, that it's a universal, and so we're not surprised that it is right up there near the top. And that explains why the caring and respectful element has dropped. Looking at these same priorities amongst healthcare professionals, to doctors, pharmacists, and allied health professionals, care that's supported by current research and expert opinion is a high priority, and more so than the ability to pay issue. Nurses and administrators place less priority on research and expert opinion, and they don't also place a lot of priority on a caring, respectful environment. Instead, these healthcare professionals rate the top three priorities as care that is readily and timely accessed, care decisions made in partnership between patients and providers, and care that is based on the need instead of the ability to pay. Now, looking at support for various options to improve the healthcare system, there's a lot on this slide, and you can see the different options that we tested down the left-hand side. But where we see strong support amongst healthcare professionals is offering less expensive versions of drugs and creating a national supply system. And you see that right up at the top. There's less enthusiasm, but it is still supported by half, for offering off-hours tests and surgery to private paying clients and moving money and reducing funding for other government services. Healthcare providers agree and support that we should have a national supply system that reduces prices and offers less expensive but similar versions of expensive biological drugs. You can see that very clearly. And you can see that there's very little support for increasing taxes and then directing it to the healthcare system. Looking at specific clinical initiatives, and on this slide, we've only shown the percent who say that they strongly support each of these, rather than the total strongly and somewhat support. So there's just strong support. Repeatedly over time, we have asked Canadians what they would support as methods to improve the effectiveness of the healthcare system. And we've seen high overall support for all of these. And with the general public, we've seen that support grow since 2005. In particular, accelerating the use of personal electronic health records and increasing the use of non-physician healthcare providers. And amongst professionals, as you see here, doctors are more hesitant about strongly supporting these initiatives, providing intense support. So the public is much more likely to provide intense support for these initiatives. There is some support for access to private clinics if wait times are too long. However, this support is not as strong as some of the other initiatives that we see here. Administrators, in particular, are hesitant, with their support dropping from 80% in 2013 to 69% this year. There is strong support from providers for increasing the implementation of wait time accountability, while doctors show the least support of any of the healthcare providers. Support for various options to improve access to medications. And these are the perceptions of the healthcare professionals. Just first a note about the public. 1/4 don't provide opinion. They don't know. They can't say what to do here. But the most popular for the public is to have a government-funded national pharmacare plan. The other two options are about half as popular as a national pharmacare plan. Now, looking at this by the healthcare professionals, you can see that coming out on top, and it's less clear amongst doctors, but coming out on top amongst the other providers, you can see that the pharmacare plan is the clear winner. But doctors are more split between the pharmacare plan and more private prescription drug plans operated by private insurance companies. Interestingly, pharmacists also provide a fair bit of support there, but the clear winner amongst pharmacists is a national pharmacare plan. Now we had a new section in this survey for this year. As we often do, we like to have a timely current issue in each iteration of the survey. In this case, we looked at the issue of end of life and end of life options. These are the results amongst the general public in terms of providing support or opposition to these various options. In general, though, the majority of Canadians strongly support diverse kinds of improved end-of-life options. In fact, the majority, if you look here, strongly support each of the 4 tested options. And if you just run down the side, I won't belabor this by reading each one, but you can see enhanced pain management practices, enhanced hospice and palliative care, enhanced home care supports, and enhanced medically assisted death. The support for all options also grows with age. So when we look at Canadians under 45, 52% of them strongly support increased hospice and palliative care, and this number grows to 73% amongst Canadians aged 45 to 64, and keeps going up higher to a support of 85%, providing strong support if they're age 65 and older. Now, when we ask Canadians to provide, indicate which 2 of these items should be the top priority for end-of-life care in Canada going forward, we can see here that we don't get a clear winner. There's a lot of support for these items. But what is interesting is that while medically assisted death on the previous slide was less supported than the other 3 options, when respondents are forced to limit their support to only 2, it is the most commonly selected by Canadians as a priority. That said, its edge over the other options is slim. We see basically a statistical tie here amongst a lot of the options. The results show here that there is little consensus on what end-of-life options are best, and that there is a real interest in all of them. Now, looking at these same options amongst healthcare professionals, there is strong support for diverse options when it comes to end-of-life care amongst healthcare professionals as well. The medically assisted death comes in near the bottom, as it did with the public when they were just asked to rate each one separately. While the majority of all providers support medically assisted suicide to some degree, it does receive less support. And we also asked healthcare professionals to provide their top 2 priorities. And when we asked the public to do so, the importance of medically assisted death gained momentum. It gained a higher priority ranking. This was not the case with providers, though. Among all providers, enhanced pain management and hospice palliative care was the most strongly supported, while medically assisted death was the least supported. And clearly so. Looking forward, this was what we call a forced choice question. So we asked Canadians that when taking actions designed to medically assist the death of another, even if the patient asks for it, it may be difficult for some healthcare providers to do so. It must be considered the patient's right to access universal health care in Canada. Considering this issue, which one of the following statements best describes your own point of view? So we're trying to get closer to their point of view by forcing them to choose one of the following. And you can see that 42% of Canadians took the view that healthcare providers should be allowed to opt out of providing medically assisted death if they wish, but they should be legally obliged to refer their patient to another healthcare provider who is willing to provide that service. Only 19% say that they should be able to opt out with no mandate to help that patient gain that service. So there is support, but there's an understanding that we can't necessarily force doctors to do this. Amongst healthcare providers, we asked the same forced choice question, and their results were in line with the public, with even fewer believing that they should be able to opt out with no duty to provide the service to their patients. Now, moving on, this is a special question just for healthcare providers. You can see here that there was a good degree of fear among healthcare providers that involvement in medically assisted death could result in legal or regulatory reprisals, even in a situation, as we described it, where the federal government would have passed legislation expressly allowing for this service. So approximately 2/5 of doctors, nurses, pharmacists, and administrators have at least some fear that this would be the case, and allied health providers are less likely to say this, say that they have some fear of reprisal, but 30% indicate they simply don't know, possibly because they're not likely to face such a situation. So in summary, as we stated at the start of the seminar, this survey, the Healthcare in Canada survey, has a unique legacy of simultaneously surveying the perceptions of the public and a full range of healthcare professionals on a range of topics. And this particular presentation provides a very high-level view of what is a very long and comprehensive and just a survey that is rich in detail. But what we can run down here for you is that perceptions of the quality of healthcare remain the same as what we saw in 2013. They're at a standstill, with some negative momentum amongst the public and some professional groups, particularly nurses. Wait times remains the top concern, and even more so than the last iteration, with few believing it will improve. The supported care improvement initiatives, those sort of at the top of the public's list, are cost-saving initiatives, such as the national supply system, less expensive drugs. Use of electronic health records is continuing to get good support, and access to home and community care. Adherence to medications remains a problem. Patients are deciding on their own what they should take and when and how much. With the fears that do exist out there that the public may be leaving medicine in the cabinet to take when they feel it is necessary are well-founded, I think, from what we can see in this data set. Public supports for end-of-life options are there. There's strong support for the various hospice and palliative care and the home supports and assisted death, definitely. There's very little opposition to that, but providers are more hesitant. And all believe that providers have the right to back out, but that they have to provide support to those wanting this service so that they can find a way to get it. And as we always see in this survey, particularly given the nature of how these results are sort of somewhat static and leaning negative, is that things can definitely be better in the Canadian healthcare system. I believe move this over to Joanna to take it from here.
Thanks, Craig. As Craig just alluded, the results shared today are really only a small portion of the research that's been compiled over the last 20 years and is available for current and future use. At the start of the session, Terry spoke to the survey membership, a broad group of stakeholders, including our partners at CFHI. It's the common vision of these members that the survey and its findings provide reliable evidence to inform and influence the improvement of Canadian health policy and care. And for this reason, a Knowledge Translation Committee was created, of which Terry and I are members. And for the past several years, we have been actively attempting to not only raise awareness of the survey and its findings through webinars like today's session, peer-reviewed publications, gray literature, and so on, but the Knowledge Translation Committee also wants to better understand how individuals and organizations like yourselves use the information we create and disseminate. And we do this through the use of a variety of tools, an important one being a roster submission form, which is essentially just a brief one-pager where we ask you to tell us what survey information you're using and in what manner. And with your help, through the use of such tools, we can better track and understand what you find most valuable and perhaps what else we should explore so the survey is continually improving over time. I invite all participants to explore the program website and help us help you by taking our brief survey, which you can find under the Knowledge Translation tab, signing up for news, or completing a roster submission if you intend to use the survey findings in your work. On behalf of all Healthcare in Canada members, thank you for your interest, and we look forward to an ongoing dialogue. Jamie?
Great. Thank you, Joanna, and thank you to Dr. Terry Montague and Craig Warden for a really interesting presentation. I was scribbling notes, even though I've been privy to these slides and this information, scribbling notes all the way because there's some really fascinating findings that will certainly inform our work at CFHI, and I hope a lot of you on the line. We now have an opportunity to take any questions that people in the audience may have. So if you could please share questions that you have using the chat box at the bottom right of your screen. I will read those aloud to our presenters. Maybe to kick things off, just before we get some of those questions, give you a chance to let things percolate a little bit. I'd like to ask some of the speakers, maybe address this to any of you that prefer to answer, but maybe Craig, were there any findings that you found particularly surprising?
I think one of the most interesting results were just how much more negative nurses were in this iteration. I mean, I think throughout these findings we see a lot of consistency in the results, either where the results are similar to 2013 or where the trend line is going in the same direction across the board. So where things, we're getting a little bit more negative over time, they continue to get negative. But nurses really do stand out as having a significantly more negative view of the healthcare system and many of the specifics in this wave. And I know the obvious follow-up question is, why? Do you know why? That is something we may have to consider asking in the next iteration. But because we didn't ask them why, so we don't know.
Yeah, great. Thanks, Craig. That is something that really stood out to me too in the results, and and interesting to think about next steps and to hear. I mean, it'll be really important to hear from some of the users of the survey results and how they mobilize this information, and particularly it'd be interesting to hear from organizations with nurses on staff and how they how they move that forward, what they can do with that information. So thanks. Joanna or Terry, was there anything that was particularly surprising to you with your many years of involvement in the survey?
Joanna?
I was going to say, Terry, you go ahead.
Okay. This happens all the time, folks, with us. Yes, there is, and it jumped out at me again today. I would say that the 5 key areas, and we've provided summary abstracts for you as a takeaway from this, and you'll see basically the abstracts of articles that we've published on them. They're all important topics, but the one that struck me the most, I guess, is, well, let me deal with end-of-life care first. I was concerned when we put it in how it was going to go in the country. I think things are going to be fine. Based on what I'm reading in the paper and what we're seeing in the Healthcare in Canada survey, it's going to be okay. I don't see any flags in there. It all seems right stuff to me in the results that we're getting. I don't see any impediments. We'll refine it as it goes, but I think we're going to be very successful as a country and the Medicare process, introducing it into the process. For me, the major issue this year is patient-centered care in Canada. For a long time, we've been talking about patient-centered care. One of the reasons we put it into the survey was to define what people actually mean by it. And over the couple of years that we've been doing, or a couple of surveys that we've been doing it, certainly enhanced or timely access has been the universally dominant factor, the way the public thinks about patient centricity in care, along with caring, respectful care, and care decisions made in partnership between patients or family and the professionals. And for the professionals, predominantly care driven by research and expert opinion. These are all very, very good components, obviously. They make sense. They've been consistently supported. As a person who's been involved in patient health management for a long time, beginning in clinical trials and going into community health management, I would say that the most important thing that we could do is introduce more measurement into our system. And when I look at patient-centered care, we're going to continue to have a debate about it because we're not actually measuring these things that we've measured this year. But it doesn't appear that very many other people are. And one of the questions we asked all of the public and all of the professional groups to answer is, where did measuring the components of patient-centered care enter into their idea of making it better? It was amongst the lowest. It was either the lowest or the second lowest ranked by everybody. So I don't know. I think that this debate around patient-centered care is going to go along for a very long time because we're just not measuring it. We are about the only people, I guess, that have looked at it in a hard way of measuring it. But I think unless we do that, we're not going to be able to. We'll be doing this forever unless we can introduce measurement and feedback. Measurement and feedback is another thing that might help the other outstanding problem here of patient adherence to medication. In randomized clinical trials, which I did in my younger years, using the same kind of medications that we use in the real world, when you look, you could take 2 drugs and you look at people taking them in the real world care. About 50% of people have dropped off within a matter of months. If you look at those 2 same drugs in the same kind of patients in clinical trials, the adherence rate for 5 years is 95%. And the main difference between a clinical trial patient management and daily clinical patient management is measurement and feedback. We actually count the pills and tell the patients what we're counting them and tell them what they're doing. It's a very powerful therapeutic intervention, and so I'm sticking up today for continuing to measure things, particularly around these 2 topics of patient centricity of care and patient adherence to care. I think we can make things better, as Craig pointed out earlier.
And I'd just like to jump in. It's Joanna. I just wanted to say one thing with respect to following up on Terry's mention about the adherence and non-adherence to therapy. You know, there's a lot of attention, and even in this most recent survey, regarding a support for a national pharmacare program. But yet, if we see that 50% of the Canadians who are taking chronic medications are non-adherent to therapy, then we need some sort of action to solve this issue before we talk about having a national pharmacare program where we would anticipate then that majority of patients are still going to be non-adherent, because we saw in the results of this survey that cost is not a factor. So even if cost is not a factor and we have a national pharmacare program, what are we going to do about this non-adherence issue? And we know that education alone is not enough. Terry mentioned some things about measurement and feedback, but medication taking is also a behavior, and so we need to think about some of those strategies that have been proven effective in trials. And I just want to thank Bonnie. I noticed that you made a suggestion for your future survey, so I really appreciate that. Thanks, Bonnie.
Yeah, Joanna, I also noticed that Louise Bouchard asked if we could produce gender-based results on the different views of men and women. Yes, we can.
Yeah, so I'd encourage folks to visit the website. There is a data request form, so if you wanted to tease out some of the data, we can work with our colleagues at McGill to see if this can happen.
Oh, okay. Thank you so Thank you so much, Terry. Sorry, we had just a blip on my audio there. Thank you so much, Terry and Joanna, for your responses and for responding to some of those questions there on the line. I'm just scrolling through to see if there's another question. You just mentioned the gender-based results. There's a lot of interest around that, and we're doing some work around that here too, CFHI in the coming year, so I think we'll be seeing more about that. I see a new question that's just come up. With the emerging crisis with opioids and drug deaths, will there be questions and measurement in future surveys? Is that something that you could respond to?
Joanna, can I go first?
Yes.
It's Terry. This is from Bonnie Ramsey at the Kingston Family Health Team. Glad to hear that you're in a team that gets high praise amongst both the public and the physicians these days. I think this is a very important question. I don't know what the right question is, so I was wondering if you would help us out here. If you have expertise in this or insight or inspiration, could you write to us and suggest what you would like to ask?
Great, and Terry,
or I'd ask you to do that. I realize you can't talk on this, but please do that.
Yeah.
Send it to us.
Great. So Bonnie, you can maybe follow up. We'll be sharing some, you can type it into the chat box now or follow up with Terry and Joanna afterwards. We'll be sharing, at the conclusion on our last slide, we'll be sharing a link where you can follow up with more information. And following the webinar, we will be posting the summary, the synthesis, the abstract that Terry and Joanna referred to, that you can see a summary of all of the results. And follow up with the team if you're interested in getting involved or providing some of that information that they've requested around use or ideas for future surveys. So right now, I think we're about to launch our live poll. So I just once again want to thank Dr. Terry Montague, Craig Warden, and Joanna Nemes-White for their excellent presentations today and fascinating information. And thanks Kelly and Sheena here at CFHI working behind the scenes to make this webinar happen. And a big thank you to our audience for joining us today. So now you'll see your feedback is invaluable to us for future webinar design. We really appreciate it. So we ask you to take a moment to provide some feedback on today's session. And you'll see some polling questions available to you. I'll read those aloud right now. This webinar increased my knowledge about the results of the 2016 Healthcare in Canada survey. The first question. Second question. I learned how the 2016 Healthcare in Canada survey can benefit my organization's decision-making processes. Overall, I was satisfied with the webinar experience. And the fourth question, I will be able to apply what I learned from the webinar in my workplace. It's interesting for us to learn about youth. And the fifth question, do you have any other comments or suggestions? So we can share this information with our presenters today afterwards if there's particular comments or feedback you want to provide about their work in the Healthcare in Canada survey, and certainly with us about the webinar and the on-call series that we host here at CFHI. Okay, so now we'll thank you to complete that poll, and we will start to sign off now. We invite you to sign up for our CFHI newsletter and keep an eye on your email for a full listing of our upcoming events. And that concludes our webinar today. So I wish you all a very great afternoon and happy Canada Day. Thanks very much.